So for our project, we're focusing more on preventing drug-resistant malaria. And the two ways that we're uh, focusing on preventing it is by using bed nets and teaching the people about malaria. And so things that we would be teaching about, first, what exactly is malaria? We would talk to them about what the disease is and where it originates. Parasites get infected and then they infect mosquitoes, and mosquitoes transmit it to humans. According to the CDC, malaria is a serious and sometimes fatal disease. We would talk about the symptoms. There's fever, chills, headache, sweats, fatigue, nausea, and vomiting. This is according to the WebMD. Some of the less common symptoms are a dry, non-productive cough, muscles or back pain, or both, enlarged spleen. And symptoms can appear in 7 days, and the time between exposure and illness, signs of illness may sometimes be as long as 8 to 10 months. So when we are talking about these symptoms, some people might not be sure when to seek help. And they really should start seeking help as soon as any of these symptoms start showing up. They should go and get help. Where to go? They should go to the nearest clinic or any place that has a place where they can test for malaria. It would be in Burma, so all the different locations would be different, but we would be able to teach them the closest location they could get help. What kind of medicine to take for malaria? There's a lot of drugs out there that say they are for malaria, but they're actually not. And if someone takes these, it can make the malaria a lot worse and even drug resistant if they take them. So we would tell them exactly what kind of drugs to take. And according to the CDC, these are the main drugs that are used to prevent and cure malaria. And then we'd also teach how to avoid malaria. A big thing would be how to use bed nets, to use screens on windows or doors, or the bed nets on the windows and doors. Use insectant repellents, avoid mosquito bites, get treatments quickly, and use all the medication prescribed to avoid drug-resistant malaria in the future. A lot of times people start to get better and so they stop taking the drugs. And then if they get the disease again, it comes back even harder. We would also explain why bed nets are so important. According to the CDC, they are proven to show they decrease malaria in the areas that they are used. They help prevent disease and even death. They kill mosquitoes so others in the community are safer, and they prevent death in children under the age of 5 by like 20%. So it's a really big deal, especially in areas where malaria is so popular and common. We also teach about how pregnant women and children are more susceptible. Newborns and infants less than 12 months of age are one of the most vulnerable groups affected by malaria. During pregnancy, malaria infections in the mother cause low birth weight and result in infant death, according to WHO. So it's a really big thing that they know they need to be careful and be cautious about malaria because it can affect them so much more. Some people might say that this is a waste of time, but there's been a lot of research that proves that the more people know about where malaria comes from and how to deal with it, the more that they will seek help and they will try to get better. And they'll go and get help as soon as symptoms start to come up, and they'll be better able to avoid it once they know where the disease's origin's at. One of the big things about teaching that to make it work is you have to monitor. So we would probably stay in an area for a little bit and watch the people and see and make sure that their behavior changes, that they're using the bed nets, that they're trying to avoid mosquito bites. That pregnant women and children are very cautious, especially when it comes to mosquito bites and any of the other symptoms.